Bismillahirrahmanirrahim. These are the MCQs regarding the cardiac muscle. Cardiac muscle fibers are connected end to end through specialized junctions that allow synchronized contraction. What are these structures called? These structures are called intercalated discs. Intercalated discs contain gap junctions plus desmosomes enabling coordinated contraction and structure stability. Cardiac muscle. Which type of nuclei are typically seen in the cardiac muscles? Single central nucleus is present. Cardiac myocytes mostly have one centrally located nucleus, unlike skeletal muscle. Skeletal muscle has multinucleated. Skeletal muscle is multinucleated. Which layer of an artery contains concentric elastic sheets and elastic arteries like the aorta? Tunica media. Elastic arteries have thick tunica media containing multiple elastic lamella to withstand high pressure. Which of the following best distinguishes vein from the arteries? Veins have valves in the lumen. Valves, especially in the limbs, prevent the backflow in the low pressure venous circulation. Capillaries. Which type of capillary contains small pores in endothelial cells, allowing exchange in the kidneys and endocrine glands? Fenestrated. Fenestrated capillaries have pores, high permeability, kidney, glomeruli, intestines, endocrine glands. Purkinje fibers differ from typical cardiac muscle fibers due to the rich glycogen content and paler staining. Reason is Purkinje fibers are pale due to low myofibrils plus high glycogen plus rapid contraction. Which statement is true regarding the tunica media of the vein? They are thinner and poorly developed. Veins operate under low pressure, so they require less smooth muscles. Gaseous exchange mainly occurs in the continuous capillaries found in the muscles, skin, lungs, and tight endothelial junctions allow selective gas diffusion. Which structure stores calcium for contraction in cardiac myocytes? Sarcoplasmic reticulum. SR releases calcium, binds troponin, initiates a contraction. Which location contains sinusoidal capillaries? Liver. Sinusoids have large gaps allow passage of cells and macromolecules. Which adult structure is primarily derived from the bulbus cordus, smooth part of the right ventricle, infundibulum? Bulbus cordus, conus arteriosus plus aortic vestibule. Defect in the formation of the aortic pulmonary septum results in which congenital anomaly? Tetralogy of Fallot. AP septum. Aorticopulmonary septum malalignment leads to pulmonary stenosis, VSD, overriding of aorta, and right ventricular hypertrophy. Transposition of great arteries results due to the failure of the spiraling of the aorticopulmonary septum. Straight aorticopulmonary septum, wrong connection of the great vessels. The superior vena cava is derived from right anterior cardinal plus right common cardinal vein. Right-sided cardinal venous system persists. Superior vena cava formation. The hepatic segment of inferior vena cava develops from the white line vein. White line system forms the hepatic sinusoid. Hepatic segment of the inferior vena cava. Persistent left superior vena cava is due to the persistence of the left anterior cardinal vein. It normally regresses. Failure leads to the persistent left superior vena cava. This is a defect. The third aortic arch arises from which structure? It arises from the common carotid artery. Third arch leads to the common carotid artery plus proximal internal carotid artery. The sixth aortic arch gives rise to ductus arteriosus. Left fifth arch forms the ductus arteriosus and proximal pulmonary arteries. In the right fourth aortic arch, if the right fourth aortic arch fails to develop properly, which structure is affected? Right subclavian artery is affected. So, which forms the right fourth arch leads to the proximal right subclavian artery. Failure of the neural crest cell migration in conotruncal junction region results in which anomaly? Truncus arteriosus. Neural crest involvement leads to the septation of the truncus arteriosus. Second year medical student examines an electron micrograph of muscle tissue showed branch fibers with central nuclei, intercalated cell junctions, many mitochondria, visible striations, and brown pigment granules. Which tissue is being observed? Cardiac muscle is being observed. And SEQ regarding the cardiac histology is also important, which can be asked to you in the SAQs. Cardiac muscle branch cells 1 to 2 central nuclei, striations, intercalated disc, abundant mitochondria, lipofuscin granules. A 51-year-old male presents with left-sided flank pain radiating posteriorly. CT scan imaging reveals a vessel coursing in front of the aorta to drain into the inferior vena cava on the right side. Persistence of which embryonic vein causes this anomaly? Left subcardinal vein. Anomalous left renal vein pattern results from the persistence of the left subcardinal vein. A 45-year-old woman presents with the venous congestion involving the head, neck, and Arms. Imaging shows obstruction of superior vena cava. Which vein mainly forms the superior vena cava in the development? Right anterior cardinal vein. Superior vena cava is derived from the right anterior cardinal plus right common cardinal vein. A 6-year-old boy has exertional dyspnea, a systolic murmur at upper left sternal border, wide fixed S2 split, which defect is most consistent, atrial septal defect, which is the reason is fixed wide split S2 hallmark of ASD due to the chronic increased right ventricular filling. A newborn is cyanotic with bowel sounds in the chest. The left thorax appears distended. Which embryonic structure is defective? Pleuroperitoneal membrane. Bogdelic hernia occurs due to the failure of the pleuroperitoneal membrane closure. Third 3-month-old infant has imaging show smooth walled portion of the right atrium distinct from the trabeculated pectinate area. Which origin gives rise to this smooth part? Sinus venosus. Right hand of the sinus venosus forms a smooth right atrium, sinus venerum. A child has a hole in the interatrial septum allowing left atrial to right atrial shunting. Which developmental failure best explains this? Fusion of the septum primum with endocardial cushion failure leads to the persistent ostium primum ASD. A 10-year-old boy has absent femoral pulses but high arm BP and a murmur. Coarctation occurs most commonly distal to the origin of the left subclavian artery. Adult type aortic coarctation typically occurs after left subclavian. A neonate with cyanosis shows egg on a string heart on chest X-ray. Which condition is most likely? Transposition of the great arteries. Classic X-ray sign. Boot-shaped heart is for tetralogy, and egg on a string is for transposition of the great arteries. And there will be the enlarged heart in the X-ray. A thymic tumor compresses the inferior opening of the right atrium. Which veins drain here? Inferior vena cava. Inferior vena cava enters inferior part of the right atrium. A girl with fatigue, wide fixed S2 split is diagnosed with ASD. Defect arises from the abnormal development of interatrial septum. Interatrial septum defect, septum secundum primum developmental failure. A newborn has an abnormal development of the portal venous system. Which embryonic vein normally forms the portal system? Right vitelline vein. Vitelline vein form the portal venous system. Right side predominates. CT scan reveals duplicated inferior vena cava. This anomaly is caused by the persistence of the left supracardinal vein. Double inferior vena cava, persistent left supracardinal vein. Endothelial cells, granules storing von Willebrand factor are viewed on the extracellular matrix. These granules are called Weibel palade bodies. Contain VWF plus P selected in endothelial cells. Microscopy of a blood vessel shows thick folds of the tunica intima and longitudinal muscle is the tunica adventitia. This vessel is most likely a large vein. Large veins have, example, inferior vena cava have folded intima plus longitudinal adventitial muscle.